Instrument for composite restoration for both anterior and posterior restorations are as follows: mouth mirrors, explorers, tweezers, spoon excavators, cement spatula, plastic filling instruments, composite placing instruments, different ones for anterior and posterior restorations, composite polishing discs of different grids, proximal finishing strips, dental floss for passing through proximal composite restorations, glass slab, composite finishing stones of different grids, slow speed handpiece, high speed handpiece, applicator tips for denting bonding and applications, diamond burrs, TOEFL wire retainer, contragonal and regular, ivory number 1 matrix band or TOEFL wire retained matrix band, lycra smelting wedges, mylar strip or polyester. Class 1 composite restoration, unlike Class 1 amalgam restoration, do not require specific shape or specific dentin depth. But the procedure shown in this video presentation is Class 1 conventional composite restoration, which requires a dentinal depth of 0.2 mm and cavity outline form going smoothly around the cut. The width of the cavity is determined by the extent of the caries. The preparation is usually done using diamond abrasive, not tungsten carbide burrs. And this will be the final outline shape of the conventional composite restoration with smooth pulpal floor and 0.2 mm into denting. The enamel wall is again being roughened using high-speed diamond abrasive, and this is followed by etchant application for 20 seconds. After 20 seconds, the etchant is rinsed away and the preparation is dried thoroughly with the air. Once the etchant application has been dried and rinsed off, this is followed by dentin bonding application, followed by light curing for about 20 seconds depending on manufacturer instructions. Once the dentin bonding agent has been cured, composite is placed in increment manner. Each increment should not be more than 2 mm. The first increment is thoroughly condensed into all the point angle and line angles. The first increment is cured, the curing is done for 40 seconds. Second increment is placed, and a little larger condenser could now be used so that it could be better adapted over the cable surface margin. A burnisher, ball burnisher or even a head burnisher could be used so that a proper anatomy could be carved out. This procedure also aids in better adaptation over the cable surface margins, and minimal contouring and finishing will be required in the future procedures. The composite has now been cured, and this is followed by contouring procedure, which is started with a small round tungsten carbide burr of over 80 to 24 foot. An explorer is passed to find out if there are any discrepancies in the cable surface margins. Contouring is continued with the round burr. Explorer is again used. Maybe a discretely eyed carver could be used to evaluate the discrepancy in cable surface margin between composite restoration and the tooth structure. Contouring is again continued with the same round burr. We are trying to get as anatomically close to the morphology as possible in this contouring procedure with the burrs. During this finishing procedure, we must be careful that you are not removing excess of composite and leaving undermined composites. The finishing procedure is started with different grids of polishing stones, starting from medium grit and going about finer grits. This imparts the final smoothness and luster to the composite restoration.